First of all, thank you very much for this third opportunity as a keynote speaker accorded by ICRLSH. Once again, thank you very much, ladies, gentlemen, and colleagues. Good morning, everyone. Thank you very much for joining us in this online international conference organized by ICRLSH and HP Association in order to share some ideas and scientific experiences together. My name is Nasser. I'm Professor of English Specific Purposes in Different Sciences, exactly in Risk Factors for Cardiovascular Diseases at University of Blida2 in Algeria. Today, we're going to present a paper titled Effectiveness of Concept Mapping Through Problem-Based Learning on Learners' Critical Thinking Skills in Medical Education. Case, University of Medicine, Algiers, Algeria. The presentation has divided into the following three main parts. At first, the salient inputs and outputs of the study. We'll be looking at the most important elements of our inputs and outputs of learning and teaching cardiac troponins using concept mapping, problem-based learning, and a combination of concept mapping through problem-based learning in order to improve critical thinking skills at University of Medicine, Algiers, Algeria. At second, our main part, we'd like to show how learning process and our conceptual framework of concept mapping through problem-based learning in a field of risk factors for cardiovascular diseases or heart diseases using cardiac troponins. And finally, at last, our conclusions and recommendations to summarize the main results of our study. As usual, we'd like to begin the presentation with a map to show the salient elements of the study, and then we'll ask our fundamental question. So as you know, and as can you see from the map, it's clear to us the difficulties and challenges of learning and teaching and also improving critical thinking skills in the field of risk factors for cardiovascular diseases or heart diseases using cardiac troponins due to several obstacles such as first element, learning to think theoretically, practically, critically, creatively, and empirically within a specific topic such as cardiac troponins is essential not only to learning its most important contact, but also to internalizing it as a dimension of lifelong thinking and learning. So medical learners should internalize theory with practice as well as to analyze and evaluate different types of data, information, and knowledge. Second element, most educators agree that learning and teaching critical thinking is an essential priority in medical education, fostering medical learners' ability to think critically, creatively, to reason, and to use judgment in decision-making. Also, enhancing the development of medical learners' critical thinking is regarded as an essential outcome of medical education. Third element, the majority of critical thinking definitions include cognitive skills such as problem solving, knowledge, reasoning, and logical thought processes. Fourth element, the medical learner's skill in solving the health problem can be seen from the medical learner's ability in solving the health problem by using stages consisting of understanding the health problem, make plans, implement the plan, and finally recheck critical thinking again. Fifth element, critical thinking becomes an essential competency for 21st century medical learners. The concept of decision-making, problem-solving, critical thinking, diagnostic reasoning, clinical reasoning, and critical thinking have been used synonymously in a medical education literature. Sixth element, critical thinking is a methodology that helps medical learners develop a deep understanding of risk factors for cardiovascular diseases, heart diseases, as well as the competencies required to succeed in critical thinking in order to predict different types of heart diseases and cardiovascular diseases related to acute myocardial infarction. Seventh element, there are different critical thinking tools that can be used to promote active processes of concepts, including concept mapping, problem-based learning, and concept mapping through problem-based learning. Eighth element, the practice of cardiac biomarkers for cardiovascular diseases or heart diseases requires complex and advanced personal and interpersonal relationship skills such as critical thinking skills that to be developed by medical learners in concept mapping, problem-based learning, and concept mapping through problem-based learning. So critical thinking skills are a crucial component of learning and teaching cardiac troponins, especially in acute myocardial infarction. Ninth element, some evidence suggests that concept mapping, problem-based learning, and concept mapping through problem-based learning are an effective learning and teaching strategy for teachers and medical learners to examine their prior and existing knowledge and learn how to critically and creatively analyze a complex health situation in a matrix manner. Last element, in the 21st century, the main goal of medical education is to strengthen medical learners' critical thinking skills as well as knowledge acquisition and application, which help them to analyze data, information, and knowledge critically and creatively, and then apply those to the existing data, information, and knowledge. Finally, we can summarize the salient elements of the study through the following figures. As you know, and as can you see, using concept mapping through problem-based learning characterized by the use of the patient problems as a context for medical learners to learn cardiac troponins and in order to develop critical thinking skills and knowledge acquisition applications so they can identify, organize, analyze, diagnose, and assessment patient problems in a logical reasoning and apply their clinical judgment and decision making to solve more complex health problems in any given situation. So, knowledge and skills are essential for reasoning, clinical reasoning skills, clinical judgment, and decision making. Some skills are more important than others when it comes to critical thinking. Many researchers proposed different views regarding the definition of critical thinking. For example, some considered critical thinking as a skill, some as a processes, and some as a procedures. The skills that are most important are interpreting, analyzing, assessment, and evaluating, and self-regulating. So our fundamental question is how concept mapping through problem-based learning could be used to enhance the process of learning and teaching critical thinking skills in medical education. I will return to our answer at the end of our presentation. Right now, let's move into our first part, the salient inputs and outputs of the study, characterized by 6 elements as follows. First element, what is critical thinking? Critical thinking can be considered as a complex cognitive process involving the interactions between the medical learner's knowledge, intention, and different types of skills. So critical thinking consists of 3 components are process, method, and purpose. Second element, what is critical thinking skills? Critical thinking skills can be considered as a multidimensional cognitive construction that implies the interaction between inductive and deductive reasoning and creative processing, different phases of critical thinking. So critical thinking skills include inference, analysis, interpretation, explanation, synthesis, and self-regulation. Third element, what are cardiac troponins? Citian, the troponin complex plays an important role in a regulation of skeletal and cardiac muscle contraction. The troponin complex consists of 3 subunits, troponin T, troponin I, and finally troponin C. Cardiac troponin is a marker of acute myocardial infarction. It does not differentiate acute from chronic injury. Fourth element, what is concept mapping? The literature review indicates concept mapping generates a chance for medical learners to actively learn and teach, and also apply their prior and new knowledge in a learning process in order to develop their core of critical thinking skills. Fifth element, what is problem-based learning, PBL? Many researchers indicate that in PBL, medical learners are presented with ill-structured health problems to apply prior knowledge and build upon their new knowledge throughout the learning process, and also provides meaningful learning for them and promotes the development of critical thinking skills. Finally, what is concept mapping through problem-based learning? Using concept mapping through problem-based learning is not only to accumulate medical learners' knowledge, but also to stimulate and reflect more on medical learners' development of special skills, such as critical thinking skills and competencies during this process of learning, in which medical learners are encouraged to think critically and creatively in order to solve more complex health problems. Right now, let's move on to our second main part, characterized by three elements are follows. First element about learning process of cardiac troponins using concept mapping through problem-based learning, shown by figure number 1. In this model, the medical learners generate their prior knowledge and then create or build upon their new knowledge from the ill-structured health problems, which is considered a learning context and objective to help medical learners receive different types of skills of critical thinking skills, clinical reasoning skills, logical reasoning, clinical judgment, and decision making. Also, it consists of three broad categories as follows. The first category about learning context and objectives in the field of cardiac troponins. The second category related to identify, organize their prior knowledge in order to build upon new knowledge and also to develop different types of skills, such as critical thinking skills. And finally, the last category about the outcomes of the study or results of learning processes, including critical thinking skills with clinical reasoning skills, problem-solving skills, clinical judgment, and finally decision making. Second element about the conceptual framework of the key components of critical thinking skills, shown by figure number 2. Schematic of critical thinking skills and concept mapping through problem-based learning and its relationship to other skills in a form of a diagram that shows the main relationships but not the details. So the learning process is shown schematically in a figure number 2. Types of learning processes of green boxes provide descriptions of each type and show how the knowledge and skill build upon each other as a result, while white boxes represent the problem-solving, reasoning, and decision-making skills. So the critical thinking skills can be developed by means of concept mapping, problem-based learning, and a combination of concept mapping through problem-based learning, in which the medical learners are encouraged to build upon new knowledge and skills from the real-life structured problems. So the combination of concept mapping through problem-based learning aims to enhance medical learners' critical thinking skills. In addition, and in order to solve more complex health problems, our medical learners are expected to understand the learning process of concept mapping, problem-based learning, and critical thinking skills, become more skilled in choosing and identifying different strategies and tools of learning and teaching. Finally, organize their prior own knowledge and critical thinking skills. Also, our medical learners are expected to, finally, to become more effective critical thinkers and also will be able to have a better social skills, cognitive and metacognitive skills, clinical skills such as problem-solving skills, clinical reasoning, logical reasoning, and finally, knowledgeable, well-informed about their specific topics and learning processes in order to develop their critical thinking skills in a field of cardiac troponins. Last element, shown by figure number 3, about our methodology characterized by 5 elements as follows. First element about our problem. The present study attempted to combine concept mapping through problem-based learning in cardiac troponins for cardiovascular diseases and heart disease in order to enhance critical thinking skills at University of Medicine Algeria. Second element about our participants. The sample consisted of 84 year undergraduate medical learners at Algiers University of Medicine were involved in this study. They were randomly selected and divided into 2 groups. An experimental group 40 taught by using concept mapping through problem-based learning and combination of concept mapping through problem-based learning, and control group 40 taught by using traditional method. Also, each group is subdivided into 8 smaller groups consisting of 5 medical learners. Third element about our instruments. The data are collected by using the 3 instruments as follows: the pre and post tests, the average normalized gain G to evaluate the level of critical thinking skills, and finally 16-item questionnaire about using concept mapping, problem-based learning, and finally combination of concept mapping through problem-based learning. Fourth element related to our subjects. The subjects focus on a range of topics related to cardiovascular disease and heart disease, such as heart anatomy and heart diseases, cardiovascular diseases, electrocardiogram, acute chest pain, acute myocardial infarction, cardiac troponins, enzymes and troponin proteins, critical health literacy as clinical risk factors for cardiovascular disease and heart diseases, emergency department, clinical audit, clinical learning, environment, and finally artificial intelligence in cardiac troponins. Last element about our procedures shown by figure number 3. The study process is based on 6 broad stages for the success of the implementation of concept mapping, problem-based learning, and the combination of concept mapping through problem-based learning in a field of cardiac troponins in order to develop critical thinking skills as follows: preparation, health problem scenarios of different case studies, preparation, and also different sessions of concept mapping, problem-based learning, and a combination of concept mapping through problem-based learning, before finally assessment of level of critical thinking skills, and finally data interpretation. Right now, let's move on to our last part, third part, related to results, recommendations, and conclusions. First element about our results, characterized by 3 results as follows. First, clinical reasoning, logical reasoning, problem-solving skills, and critical thinking skills are interchangeably used in medical education in the field of cardiac troponins. Other terms which are used in relation to critical thinking include analytical thinking, diagnostic reasoning, problem-solving, clinical reasoning, critical judgment, decision-making, creative and reflective thinking. Second result, the majority of medical learners, more than 90%, found concept mapping, problem-based learning, a combination of concept mapping through problem-based learning and critical thinking skills necessary to assist them in learning process of development and learning of the key components of critical thinking skills, especially inference, deduction, assumption, interpretation, reasoning, and evaluation in cardiac troponins. And finally, overall, medical learners using concept mapping, problem-based learning, and combination of concept mapping through problem-based learning with medium level of critical thinking skills obtained higher scores compared with medical learners in lectures with low level of critical thinking skills. Furthermore, significant enhancement in critical thinking skills was observed in medical learners with concept mapping through problem-based learning, but not with traditional learning. Second element about our recommendations characterized by 3 recommendations as follows. First, we posit to use a wide variety of learning and teaching innovative strategies in our lectures that include concept mapping, problem-based learning, problem solving, clinical reasoning, clinical thinking, and concept mapping through problem-based learning in order to develop and increase critical thinking skills in cardiac troponins. Second recommendation, in order to reduce expectations between teachers, ward staff, medical learners, and university, we must focus on learning processes using a combination of different innovative strategies that develop knowledge and skills in cardiac troponins. Finally, medical learners must learn the process of critical thinking in order to eliminate the most important barriers of learning and teaching critical thinking, and also to integrate critical thinking skills in medical education, such as lack of training and practicing, lack of data information and variety of knowledge, preconceptions, inquisitive about a topic, and finally, time constraints. Finally, and last element of our third part about our conclusions. The study showed that critical thinking skills positively correlates to a medical learner's performance using concept mapping through problem-based learning and perform better in their scores, and also found them very interesting and effective tool for learning process and increasing critical thinking skills in cardiac troponins. In the end, you will find all references and information with all data and procedures of the study using concept mapping, problem-based learning, and concept mapping through problem-based learning in the field of cardiac troponins. Once again, thank you very much.